Welcome to our audience members joining from around the world. I hope you're staying safe and healthy. My name is Puneet Talwar, and I'm a senior fellow with the Asia Society Policy Institute. This is our 11th event in a series titled The Coronavirus, Asia, and the World. We're absolutely delighted to have with us today India's ambassador to the United States, Taranjit Sandhu. Ambassador Sandhu is no stranger to Washington. In fact, this is his third assignment here. He previously served as Deputy Chief of Mission in the embassy from 2013 to 2017, and as First Secretary in the political section from 1997 to 2000, which is when we first met. He has also had numerous other assignments in his illustrious career, in India's permanent mission to the UN, in New Delhi, and most recently as High Commissioner to Sri Lanka. Ambassador Sandhu has made many friends along the way, and I'm proud to count myself as one of them. He brings to his job not only a deep understanding of policy, but also a personal touch and a sunny disposition, which makes him one of the most effective ambassadors I've worked with. He always wants to understand where you're coming from, and he has a knack for delivering news that you may not want to hear in a way that never alienates. In short, India could not have made a better choice in appointing him to this post. Mr. Ambassador, thank you for taking the time out of your busy schedule to be with us today. We're eager to hear from you about India's response to the COVID-19 pandemic. We don't have very long, so let me turn the floor over to you.
Thank you, Puneet. Good morning. And you're absolutely right. I very clearly and vividly recall our interactions go back to 1997. And thank you for the wonderful introduction. I hope what all you have said actually is or comes true. Thank you so much. Let me make a few introductory remarks because it's very, very important. This is a very serious issue and we need to understand it in the right perspective. The outbreak of coronavirus is an unprecedented challenge for an increasingly interconnected world. The rapid spread of virus across the globe in a relatively short period of time showed that the virus was ahead of us. Governments across the world are making efforts to slow the spread and flatten the curve so that our medical infrastructure is not overburdened. With a population of over 1.3 billion people, the risk posed by the pandemic in India is grave. There are also challenges which are specific to India. The capacity to deal with the disease varies from one region to another. At the same time, there are some factors which may be construed as advantages. Keeping these factors in mind, mitigation was the best strategy available for us. Our government has taken early and preemptive measures since January when the first information of the outbreak from China came. The initial risk of the disease came from international travel. We started screening at our airports even before the first confirmed case in India was detected on 30th January. We put in system a graded visa and travel restrictions through February and March, even before WHO declared this as a pandemic. When the number of cases touched 600, we announced full-scale lockdown. You can imagine locking down a country of 1.3 billion people was not an easy decision. In a democracy, it requires the support of the people. In a federal system, it requires all the states governed by different political parties to come on board. For India, where large part of workforce is employed in the informal sector, and there are significant number of migrant workers, lockdown produced unique challenges. Prime Minister Narendra Modi demonstrated decisiveness as saving lives was the utmost priority. Before a full-scale lockdown was announced, PM Modi appealed to the people to observe a one-day voluntary curfew on 22nd March. This prepared us to go ahead with a nationwide lockdown from 25th March, which has now been extended up to May 3rd. We are now 27 days into the close down. As far as the current figures of active confirmed cases in India stand, this number is approximately 15122. Around 3,259 cases have been cured. The number of deaths is around 603. The rate of doubling of infection at present is around 7.4 days. This was about 3.4 days on 17th March. WHO has publicly appreciated our proactive approach. The lockdown was total in the sense that schools, colleges, government offices, and private sector have closed to work from home. Domestic travel, including passenger trains, flight services, and public transport, has been suspended. At the same time, essential services, supply of energy, power, water, food, and banking, movements of goods and cargo has continued. We are looking at gradually easing restrictions and expanding essential services to include more sectors. The government has also devised detailed guidelines on how we will gradually open up. There were initial challenges in implementation of the lockdown in terms of reverse migration of migrant workers. To tackle this, more than 28,000 relief camps were set up for over 1.25 million people. Provision of food is being made for over 7.5 million people through food camps. The state governments, district administration, and an elaborate network of civil society organizations have been involved in the process. Even as we battle the pandemic, the government is conscious of the hardship of people, essentially those whose livelihoods are affected. We announced $22.6 billion stimulus package aimed to provide a safety net to most vulnerable, that is the small farmers, daily wage workers, poor senior citizens, through direct cash transfer. A series of earlier reforms undertaken by Prime Minister Modi in terms of access to banking for ordinary citizens through a program known as Jan Dhan, along with the expansion of Aadhaar, a unique 12-digit ID, coupled with our proactive efforts to digitize payments, has ensured that the cash transfers reach the intended beneficiaries. A separate insurance cover is being extended to healthcare workers who are at the forefront of the battle. The lockdown has brought us time to wrap up production of PPEs, ventilators, test kits. We are focusing on capacity building of doctors, paramedical staff at airports, rapid response teams to enhance preparedness. We are focusing on increasing the number of isolation wards across the country. Going forward, our strategy is to avoid incidents of community transmission. A massive contact tracing and surveillance operation is continuing on a nationwide scale to preempt spread. The local administrations have set up screening teams of primary health workers at village and town level, established a network of hospitals to track possible transmission, and aggressively screen and test suspect cases. We have a vast network of trained female healthcare workers, ASHA, who are really the foot soldiers in this fight, going household to household in every village to track possible cases. Meanwhile, our elaborate network of scientific institutions is at work on the genetic sequencing of the virus, diagnostics, vaccines, antivirals. We have successfully run massive immunization programs in the past, which helped in the eradication of polio, and that experience will be handy in the fight against coronavirus. Indian pharmaceutical companies are global leaders in producing affordable, low-cost medicines and will play an important role in the fight against this pandemic. We are one of the largest producers of hydroxychloroquine, which has seen a spurt in demand in recent weeks. We have sent the drug to over 50 countries over the last few days, including the United States. In fact, India and the US have a robust partnership in the area of health and scientific research, which will be critical in the fight against this disease. Perhaps the most successful tangible example of our successful bilateral cooperation in recent years was the development of the rotavirus vaccine, which saves thousands of lives every year. Our network of scientific institutions, including the Indian Council of Medical Research and the NIH and CDC in the US, are in touch with each other. This is part of our long-standing cooperation, which has been energized in the context of this pandemic. Our companies are also collaborating with the co-development of the vaccine. The US-India Science and Technology Endowment Fund has called for proposals that would enable scientists to collaborate and to carry out joint research and also work towards the development of new technologies, tools, safety, outreach, etc., to fight COVID-19. Our industry is playing an important role in the ongoing efforts, whether it is Indian companies in the United States or the American companies in India. They are coming up with innovative solutions and supporting local communities. And every effort matters at this stage. The shape of the world order that will emerge from the pandemic may be unfamiliar. We need to navigate through this crisis through a coordinated response, and individual countries need to rely on their strengths. Pandemics are not new. They have existed through history in Europe and in Asia, from the Black Death to smallpox. What is new is our ability to confront them, where the advances in medical sciences have been joined in the spirit of cooperation with our friends in the United States. As global strategic partners, India and the US are prepared to face this together, as we are ready to deploy the full strength of our partnership to fight this pandemic, as my Prime Minister has said.
Well, thank you very much, Mr. Ambassador, for those incredibly informative remarks. You've painted a vivid picture for us of the scale of India's response, not just in terms of the number of people affected by the various mitigation measures, but also how India is working at this from the technological end of the spear all the way through to the ASHA workers you mentioned, who are helping to implement these mitigation measures. We need to wrap up in about half an hour, or sorry, in about half past the hour. So I'd like to turn to a few questions to get us started. And I'd also like to invite our audience members to submit their questions online through the comment function on YouTube or Facebook. So to begin, Mr. Ambassador, here in the United States, there's been a lot of discussion about testing, and the lack of it has really put us behind the curve in two respects. First, we don't have an accurate understanding of the shape of the challenge we're facing, the extent of it. And now it's potentially affecting our ability to begin to end and ease the lockdown measures. Can you tell us about testing in India? Where are you on your testing capacity? And how are you employing it to make decisions on criteria for easing the mitigation measures?
With aggressive testing for a population of 1.3 billion people poses its own set of challenges. At present, India is testing approximately 30,000 samples per day, but we are working towards scaling this up to around 100,000 per day. We have significantly ramped up testing facilities, increasing the number of laboratories. There are now about more than 223 such laboratories in viral research and diagnostics, including in the private sector. Our scientific institutions are also engaged in developing both antibody and PCR-based test kits. The challenge would be to scale up in a limited time. As per our existing testing guidelines, all symptomatic persons who have undertaken international travel in the last 14 days, contacts of confirmed cases, healthcare workers who have some symptoms, all patients with acute and severe respiratory illness, and high-risk people who have come into contact with confirmed cases have to be tested. We are also taking help from a number of our partners, including relying on imports from some of our partner countries like the US, Germany, South Korea, etc. Ultimately, we have to rely on our strengths to combat this COVID. We have a strong system of community health workers. The government has a commitment to universal primary health service. Our containment strategy is to identify clusters of infection and through surveillance, contact tracing, and isolation.
Thank you, Mr. Ambassador. One other interesting aspect of the pandemic, as you look at various responses, is that unlike authoritarian systems, federal democracies like India and the United States, we rely to a high degree on our citizens to consent to the recommendations that the government is making and to abide by them. And we also have this unique aspect of center versus state governments. And here in the United States, we've seen some of the tensions that can emerge from a federal structure on display in the last week, especially. How is this issue of the central role versus the central government role versus the state government role playing out in India? And are citizens actually following through with governmental guidelines?
A very, very interesting question. Under our governance framework, health is actually a state subject. That is, the state governments legislate on health. In effect, the central government provides policy directions, while the state governments are at the cutting edge of implementation. Of course, the capacity of individual states here vary widely. The outbreak of this particular COVID has necessitated a national response. Prime Minister himself has been at helm of India's response. He has been closely interacting with the chief ministers of all states and taking their suggestions on board. This coordination is replicated at the official levels as well. Such a consultative approach has helped build consensus around difficult decisions such as lockdown. A national lockdown of 1.3 billion people was not an easy decision. There were some challenges initially, especially in terms of labor mobility and movement of migrant workers. The state governments, along with the federal government, have come forward to set up camps which are now housing the migrant workers. The central government is providing leadership and guidance to the state institutions. Our health ministry is playing a key role in standardizing protocols through its institution and disseminating information to the state governments. So on the whole, as it is showing right now, the system is working in harmony and is working well.
Thank you, Mr. Ambassador. If I could switch to the region a little bit. Prime Minister Modi was widely praised for his recent initiative to organize a video conference of SAARC heads of state. And this was the first SAARC summit since 2014. Can you update us on where things stand with the regional cooperation on the coronavirus?
Given the transnational nature of this pandemic and India's responsibility as the first responder in the region, which we have always done whenever the crisis has come, Prime Minister took the initiative to invite the 7 South Asian country leaders, and for a video conference. This was held on 15th March. And at this virtual meeting, the Prime Minister took the initiative to establish a SAARC Emergency Response Fund with an initial contribution of $10 million from India. And this has since become operational. All the other countries have also contributed. Subsequently, a review video conference of doctors and medical professionals to consider specific measures took place in March. We are working to create a SAARC platform, and we are regularly sharing ideas and proposals for diagnostics and medical interventions with other countries. You will also be interested to know that we have already sent supplies and testing equipment to Bhutan, Maldives, Bangladesh, Afghanistan, Sri Lanka, and Nepal. As I said earlier, we do understand the transnational character of this pandemic. And while the tendency of the countries in this time would be to look inward, we also recognize the need for the coordinated action. And here I would also mention that in the extraordinary virtual G20 Leaders Summit, Prime Minister Modi had taken the initiative and has also underlined the responsibility of the G20 countries in combating this disease and announced India's contribution of 5 trillion towards the G20 countries' commitment to inject to restore global growth and market stability.
Thank you, Mr. Ambassador. One other question I'd like to ask you about. We've seen stories from around the world about how the pandemic has brought out the best in people. Unfortunately, there have been instances where it's also tapped into the somewhat darker side of human nature. For instance, here in the United States, Asian Americans have found themselves scapegoated and the victims of harassment. And we've seen reports emerge from India about Muslims being targeted after a large gathering of the missionary organization, Tablighi Jamaat, was reported to have played a role in spreading the virus. Can you tell us, how, as a multi-religious, multi-ethnic democracy, how is India handling this aspect of the pandemic?
We need to see this in proper perspective. One of the main challenges in dealing with this pandemic has been to control the spread of misinformation, disinformation. Doing so in a digital age of social media is even a greater challenge. These are the issues that all democracies have to deal with. In India too, unfortunately, we witnessed a spurt of cases which were traced to a religious conference, which had a number of foreigners as participants. This is a fact, but it is important to educate people on scientific aspects of what is known about the virus and how it spreads, and precautions that we need to take to prevent the spread. The government has been doing that proactively. Prime Minister Modi has clearly stated that the disease does not see race, religion, color, caste, creed, language, or border before striking. Our response and conduct thereafter should attach primacy to unity and brotherhood, as we are in this together. It is the collective responsibility of all to work together to fight this unprecedented medical emergency.
Thank you, Mr. Ambassador. We have one question from YouTube, which is that would India consider allowing flights on humanitarian grounds for medical emergencies? And there's a particular concern about people being able to return to India to look after their senior citizen parents who are ill.
I think there are two aspects which need to be very clearly kept by everybody in mind. There are medical directives which very clearly state and advise about social distance and second traveling. I think all medical authorities, local authorities, state authorities, government authorities in both our countries have been clearly telling people that do not travel because you are making yourself vulnerable. You are also making your friends, your relatives vulnerable. So this is the main thing which has necessitated stopping the travel. So we have to keep that in mind. You know that we have helped out in emergencies. In case of India, in fact, from 11th to 22nd, there was an opportunity to travel. But this particular ban or restriction in travel has been undertaken as part of the responsibility, not as any authority. So therefore, whoever has an emergency, do get in touch with us. But this is the primacy which you must keep in mind.
Thank you, Mr. Ambassador. I think we have time perhaps for one final question. I wanted to ask you about this recent decision by India to change the policies with respect to foreign direct investments, especially by entities or individuals who share in countries that share a land border with India. This was largely seen as directed at investments from China during this period of economic downturn in India. And the question is, what sort of impact could this have in the long term on on India-China relations?
I think this again needs to be seen in perspective. We welcome foreign investments into India. At the same time, we need to protect our economy, our companies, given the current pandemic situation. Through the new amendment, we will protect Indian entities from hostile takeover. Investments are welcome, but would need prior approval. The decision has been taken keeping in mind the complexity of the situation.
Okay, well, thank you very much, Mr. Ambassador. We appreciate all of the detail that you've provided to us this morning, and we thank you for joining us. Before I close things out, I do want to let our members know that, members of our audience, that the next event will be this Thursday, April 24th at 9 a.m. Eastern Time. The president of the Asia Society Policy Institute, former Prime Minister Kevin Rudd, will be joined by His Excellency Tijani Muhammad Bande, the president of the United Nations General Assembly, and they will be discussing the importance of multilateralism in the time of a pandemic. Mr. Ambassador, let me thank you once again for taking the time out of your busy schedule to be with us today. It's been an illuminating conversation, and we wish you and the Indian people success in the battle being waged against the common enemy of the coronavirus.
And thank you, Puneet. And I look forward to our continuing cooperation. And also, we thank all the international actors for the support and to work together. Thank you very much.
Thanks.